Hello, this is a gross pathology specimen of a case of tuberculous meningitis. There is a separate video which describes the gross features of tuberculous infection in the brain, which includes tuberculosis of the brain parenchyma as well as TB meningitis. However, this video focuses on TB meningitis. There will also be a separate video describing the microscopic features of TB meningitis. Let's turn this specimen around and we can see that this is a brain that has been transversely sectioned. The brain parenchyma itself appears grossly unremarkable. These spots are artifactual due to anchoring of the specimen within this container. And coming back to the base of the brain, to orientate ourselves, these are the temporal lobes. This is the optic chiasm, and over here the cerebral vessels, the pons, and the cerebellar hemispheres. We can see very clearly in this area that there is this pale yellowish exudate that is within the subarachnoid space, and it is overlying the surface of the pons. And if we look over the cerebral hemispheres here as well as over here, we can see that there are some of these yellowish flecks within the subarachnoid space, and these areas represent necrotizing granulomatous inflammation. We can also see how closely this exudate is related to the blood vessels at the base of the brain. Let's learn a bit more about TB meningitis. TB infection in the CNS can include TB meningitis, which is infection within the subarachnoid space, and this is the commonest form of CNS TB infection. TB can also cause direct infection of the brain parenchyma, leading to areas of necrotizing granulomatous inflammation within the brain and causing destruction of the brain parenchyma, and there can be a combination of meningoencephalitis. In terms of pathogenesis, this usually originates in pulmonary TB, which then undergoes hematogenous dissemination, and the organisms find themselves within the CNS, either within the parenchyma or in the subarachnoid space. TB meningitis and TB of the CNS can also occur in adults with reactivation of TB. Any age group can develop TB meningitis, and patients with an immunocompromised status, for example, HIV infection, or those undergoing immunosuppression or with malnutrition, have a higher risk of developing this. Clinically, there may be a low-grade fever, loss of weight, and night sweats similar to TB anywhere else in the body, and there will also be signs and symptoms that relate to meningitis, including headache, neck stiffness, photophobia, altered mental state, and potentially also seizures. Some of the complications can include hydrocephalus, and this is due to adhesions within the subarachnoid space that can hamper the flow of CSF, damage to the blood vessels causing infarction in the brain parenchyma, and also because anatomically many of the cranial nerves pass through this region, there can also be cranial nerve deficits due to direct damage of the cranial nerves. The specific diagnosis of TB meningitis requires CSF examination using cytology to identify the microorganisms with special stains such as the Zeal-Nielsen stain, and also culture and PCR can be performed on the CSF. Grossly, we can see, for example, in this more fresh case, the meninges, and this is involving the meninges over the cerebral hemisphere. There are these grayish gelatinous exudates, and this is due to fibrin. And we can also sometimes see these whitish nodular foci. These represent the areas of granulomatous inflammation. And often the infection likes to occur at the base of the brain, though not always, as you can see here in the cerebral hemispheres. There is an exudate together with these granular areas, and this can damage the optic chiasm and also involve the leptomeningeal vessels. So some of the complications will include foci of brain parenchymal necrosis due to TB damaging the vessels, giving rise to fibrinoid necrosis and thrombosis. and also potentially hydrocephalus due to obstruction of the flow of CSF. Here are more gross examples, and you can find these gross pictures with annotated labels in our free online pathology resource, Pathweb. Registration is completely free, and you can find the registration link in this video description. Here again, we can see a fresher example with these yellowish gelatinous exudates at the base of the brain overlying the pons, and over here again, these yellowish pale thick exudates. There will be a separate video describing the microscopic features of TB using a virtual microscopy slide, but very briefly, on microscopy, we will see necrotizing granulomatous inflammation within the subarachnoid space, and usually this is accompanied by many lymphocytes and plasma cells. The inflammation likes to go around blood vessels, and this can cause damage to blood vessels, and organisms may be demonstrable using the Ziehl-Neelsen stain. Here is an example of a necrotizing granuloma with associated Langerhans giant cells and with these epithelioid histiocytes and central amorphous appearing pinkish necrosis. In summary, this is an example of tuberculous meningitis where we can see this fibrinous and inflammatory exudate over the base of the brain, overlying the area of the optic chiasm, the pons, and the cerebellar hemispheres, and we can also see these yellowish, more nodular areas, which represent areas of necrotizing granulomatous inflammation. This virtual pathology specimen, which is completely interactive and also annotated, can be found in our online pathology resource, Pathweb, and if you scroll down, you will be able to find annotated gross images as well as more videos. Thank you.